For those of you, welcome to the Healthcare Development Panel discussion. And for those of you who have the chat available, certainly if you have any questions throughout this process, you can ask questions in the chat. And at this time, we will take the opportunity to introduce our guest panelists this morning. And then we have a few questions we'd like to ask each and every one of them. We have this morning Scarlett Pressley-Brown from Children's Healthcare of Atlanta. We have Dr. Sandra Valenciano from the DeKalb Board of Health, and Jen Schuck from Emory Decatur, Emory Hillandale. And so we're glad to have you guys on as our guest panelists this morning. I'm just going to take a minute for you all to introduce yourselves. I guess I'll kind of start because I guess I should have introduced myself. But again, my name is Jeff Taylor. I'm the CEO of MedCura Health. I've been the CEO here for about 16 years, and we provide primary care services to the citizens of DeKalb. We actually have locations in DeKalb County, Rockville County, and also Fulton County. So at this time, we'll introduce our panelists, and I'll start with Ms. Scarlett Pressley-Brown.
Hi. Thank you, Jeff. I appreciate that. I currently serve as the Community Development Officer for Children's Healthcare of Atlanta. My specific areas that I take care of are DeKalb and City of Atlanta, Fulton County. I'm primarily responsible for ensuring that the community is aware of who we are, what we are, and the services we provide, and to keep them educated and informed that when it comes to childcare medical needs, that Children's is the best place for those kids, up to age 21, a matter of fact. In addition, I am also responsible for continuing to generate support for the hospitals, Eggleston, Scottish Rite, Hughes Spalding, and for the urgent care centers that we support as well, making sure that as you are planning to your financial support throughout the year, that you keep us top of mind, because we are the facility that is crucial to care when it comes to medical needs for children.
Excellent, thank you. Jen Schuck.
Hey, good morning, everyone. I'm Jen Schuck. I'm the interim Chief Executive Officer for Emory Decatur Hospital, Emory Hillandale Hospital, and the LTAC, which is Long-Term Acute Care Hospital in downtown Decatur. Longtime resident of DeKalb County, grew up in the area, went to Stone Mountain High School, so have connections, and actually really excited to be a part of this panel and getting to share about Emory Healthcare, and specifically with the Emory Decatur Hospital and Emory Hillandale Hospital.
Thank you. And Dr. V.
Good morning. My name is Dr. Sandra Valenciano. I am the District Health Director and CEO of the DeKalb County Board of Health. In this role, I oversee all public health clinical services and programs that we offer to all the residents of DeKalb County. We have 6 health centers throughout DeKalb County where we provide a variety of clinical services like immunizations, family planning, child health services, WIC services, as well as other services for the entire community like vital records. And of course, we're responsible for all environmental health inspections of restaurants, hotels, motels, etc. I also serve as the incident commander of the COVID-19 response in DeKalb County.
Excellent. Well, thank you. I think we have a great guest panel this morning. And what we'll do is we have some questions that we want to go through with our panelists. And those of you who are visiting, if you have any questions, please put them in the chat. If you want to address it to one of our guest panelists, go ahead and put their name in there in parentheses, and we'll make sure that we answer those questions as we move throughout the program. So we'll get started. We'll ask a big, broad question to begin with. The question is, what are the biggest healthcare needs for DeKalb County? What are the biggest healthcare needs for DeKalb County? And Jen, we'll start with you.
Okay, thanks, Jeffrey. I think right now I'd be remiss if I didn't say vaccinations are still an issue. We're continuing to do outreach and educate as much as we can and encourage folks as far as the vaccination. Believe last week I'd heard DeKalb County was at 58%. So definitely something we want to work on. I know as a healthcare system, we're really working hard on our community health needs assessment and trying to understand the needs of the community. We recognize cancers and heart disease are some of our big areas, but we're also starting to see more around the mental health aspects, especially through this pandemic. So we will be reaching out into the community in the spring because we definitely need to hear input and the voice of the community. So, and really a lot of this is going to be around focus on prevention and early detection. So as much as we can do that, that would be great. Again, had mentioned heart disease, but also diabetes prevalence in the community. So we'll continue to work on that. And really trying to get, again, out into the community. So we had done a South DeKalb Health Summit last September and really looking at health disparities. And so that's going to be a big part for us in networking with our community leaders, including you all here, and helping us as we move forward through this pandemic and continuing to focus on healthcare.
Thank you. Dr. V, what are the biggest healthcare needs for DeKalb County?
Well, I have to say, Jen hit the nail right on the head. Because I was going to mention, the leading causes of death in DeKalb County are number one, cardiovascular disease, heart disease, and stroke, and cancers in lung, colon, and breast cancer being in that order. So from our standpoint, we have several health promotion and prevention programs that try to address these issues like diabetes prevention, obesity prevention, tobacco cessation. We also have the breast cancer and cervical cancer screening program for women who otherwise would not have access to mammograms and cervical cancer screening. And of course, in terms of the COVID-19 pandemic, we know from our data that there continues to be a disparity in access to the vaccine and equitable distribution, which we have been very strategic about making sure that we are in the community and have changed our strategy to providing the vaccine via mobile COVID-19 events to address these disparities, right? So while over 45% of cases have been among our Black African-American community, of all Black residents in DeKalb County, only 47% of them have received at least one dose. And so when you look at the opposite, while 22% of cases have been among white residents, over 62% of white residents have received at least one dose, right? So we're really working on trying to address these disparities. And then, the larger healthcare disparities as well. We know when we look at our outcomes like diabetes and obesity and heart disease and asthma and infant mortality, there are really significant disparities between North DeKalb and South DeKalb. So we try to address those geographic differences, which, there are a number of factors that play into why that is. And when we look at COVID-19, that break between North DeKalb and South DeKalb also exists. Majority of all of our cases throughout the course of the pandemic have been concentrated in South DeKalb, which makes sense, right? Because if there's higher levels of cardiovascular disease and asthma and diabetes in South DeKalb, then that community is at higher risk for COVID-19. So really focusing on addressing all of these healthcare disparities, especially as, we think about the pandemic winding down and making sure that we're addressing all of the underlying risk factors that have placed these communities at higher risk for COVID-19. And, I would be remiss if I didn't mention about our public health workforce because we currently have a 30% vacancy rate. Unfortunately, we've had a lot of turnover during the pandemic, and half of our vacancies are in our clinical positions for our health centers. So that really limits our ability to serve the community in the way that we want to serve because we just don't have the workforce to do so.
I would imagine it's been a very challenging time for you all. Even before COVID-19, all of these challenges existed, and we had to kind of shift priorities and focus during the pandemic, but these underlying conditions still existed and were still there. So I can appreciate all the challenges that you, as well as all of us, have had to deal with. Scarlett, Pressley-Brown, what are the biggest healthcare needs for DeKalb County?
Well, I think both Jen and Dr. V summed it up very, very well. The only other thing I will add is that what we have faced in terms of a big challenge has been in the area of mental and behavioral health care for our young people, having facilities that can provide long-term care and continuous care and consistent care. We get calls all the time for that. So that's one of the areas that we are making sure we're keeping our finger on the pulse of what's out there, making sure that we can provide the best care, and to ensure that from a long-term perspective, that we are giving families and children exactly what they need. That's probably one of our biggest challenges, the behavioral and mental health care.
Yes, all of you hit on behavioral health, and we see that quite a bit. See a lot of people who are suffering from depression, people who have ended their lives because of that. And I think that is a big challenge for us, particularly with our workforce, and keeping them engaged and keeping them coming to work and coming to work on time. And so I think you guys have really hit the nail on the head. So from an economic development standpoint, I guess, what are some of the new projects on the horizon for the next few years for your organizations? What have you put in your strategic plans? Perhaps if you could give us a small glimpse. I know you can't tell us everything, but just a small glimpse of some of the things that you have upcoming on your agenda. I'll start with you, Scarlett, Pressley-Brown.
So yes, I actually sent a link that I don't know whether or not you got, Jeff, but it's a video, a 3-minute video of what we have. We've got a little something going on at North Druid Hills and Interstate 85. I'm sure many of you have seen that. It's a 1.5 million square foot hospital that we're going to open. It's the Arthur M. Blank Children's Hospital. And this particular hospital will focus on cardiac, hematology, oncology, and transplant services. It will be designed to keep the proven health views of nature in play. In other words, there's going to be a very strong environmental component to our hospital. It will be a 19-story tower with 2 wings, additional operating rooms, specialty beds, diagnostic equipment. And there will also be an area that is specifically designated for clinical research, clinical trials, and overall patient care. After it's all said and done, we're planning to open in 2025, and we will be designated as a level 1 pediatric trauma center, and that will be the only one in Georgia. Scottish Rite will remain a level 2 pediatric trauma center and grow its neuroscience and orthopedic programs, while Hugh Spalding will remain focused on providing primary care and treating sickle cell and asthma. So I shared with Frankie Atwater and other members of the chamber the opportunity to come and visit the Mission Center here off of the frontage road by Druid Hills, so that you can get a preview of what the hospital will provide. Of course, it will be state-of-the-art, very, very futuristic, and actually provide an at-home experience for those families who have to spend extended periods at the hospital with their children. Very, very innovative, and providing an outlet, so to speak, in terms of when your child has to have extended medical care. That was one of our bigger focuses. We're talking laundry rooms, school-centered areas for those who have to get tutored and mentored. Just everything you could think of will be in that hospital. So if any of you would like to come and visit, let me know. I'm happy to provide a tour for you at the Mission Center and give you an idea of what to expect when the hospital opens.
Scarlett, I'm definitely going to take you up on that invitation. I've seen that facility. It looks beautiful. I kept wondering, what is it? What is it? What is it? And
Just a little something.
I see. So thank you for giving us that information. It's very helpful, and congratulations on that project. Let's see, Dr. V, what do you have? Any new projects coming up on the horizon? I know you got your hands full over there.
Okay, well, we don't have that many funds, but so we're very fortunate, thanks to our close partnership with DeKalb County government. And we, during the pandemic, received CARES Act funds from DeKalb County government, which we used to purchase mobile units. And we're very excited about these mobile units. These actually are the units we've been using to do our mobile COVID-19 events and mobile vaccination events. And that was our first model of deployment, but the long-term plan is for us to provide some of the services that we provide in our health centers in the community. Because although we have 6 health centers throughout DeKalb County, we know and recognize that there are community members that still can't access our health centers, right? So how might we be able to come to them to provide our services in the community, to the community, and try to break down any barriers, and even thinking about providing our WIC services, partnering with food banks or food pantries, and how we might enroll individuals into WIC who wouldn't even know that they're eligible for those services, right? I think a lot of our community members don't even realize that there are programs that are available to them at no cost whatsoever, if they don't have insurance or if they're underinsured. And so that's our long-term plan to do that. And we're also working on creating agreements with our medical schools, nursing schools, and technical schools to try to create more of a pipeline into the public health workforce and to be able to mobilize these units in the community, because I think that it would be a great learning experience for a lot of our students to see public health in action. Certainly, when I was a primary care resident, doing some of the community outreach work and working with our local providers is what I enjoyed the most. So it would be great to do that. That's our plan that we're working on right now.
Great. We would love to partner with you guys on that too. That's exciting. Jen?
Okay, thanks. One thing I'll do is just real quickly say that the Emory Decatur Hospital, Emory Hillandale Hospital, and the LTAC had been under the DeKalb Medical in the past and had joined Emory Healthcare in September of 2018. And lucky enough at that point that capital dollars were dedicated to the Emory Decatur, Emory Hillandale, and Emory LTAC hospitals. And that really was for an area that was capital starved to reinvest back into those buildings and the services. And so with that, we are really focusing right now from the IT standpoint. So all new computers, phone systems. Big thing that's happening in the fall, October, is we are converting our medical record system, Emory Healthcare as a whole. But what that means is that the DeKalb Medical, former DeKalb Medical system will go away. We'll be on one system. That's a major conversion that will be taking place. Then it's just focus on our service lines. So how do we make sure that we've got the primary care out in the community? We've talked about the cardiovascular care, gastroenterology, cancer, women's services. So doing a lot of work there to make sure that we've got these services. And that means building in areas like Hillandale, where we have a lot of focus on the emergency room that's there. How do we start building service lines there that help to support that community? Doesn't always sound great, but a lot of it is infrastructure and equipment improvement. So renovating in our emergency departments so that those are up to date. Room refresh, beds, operating room equipment, imaging equipment, security enhancements, all the way down to elevators. And we have some HVAC systems that are from 1960 that are original to the building that we're using dollars to fund there. So all that helps us to really support the patient experience when they come in and make sure that we're giving high quality care and getting the outcomes that we need. And that means for us, in order to accomplish all this, really is working smarter, not harder. So we're using a lot of lean methodology to really make sure that we're giving value services at the lowest cost we can. And that also means reaching out into our community. So very excited that we are working on a transitional care clinic that will be based on the Decatur campus. That will help us reduce some of that stress on our emergency rooms, work on preventing readmissions, and just helping to improve the overall community health. And so really excited, continuous progress, and we'll continue to do that in spite of the pandemic that we've gone through, and may have slowed us down, but we'll continue to focus on driving for experience and outcomes.
Yes, Jen, these are really challenging times, and in order to manage growth, you have to work on your infrastructure.
Correct.
Not only people, but systems, equipment, technology, all of that stuff that just happens behind the scenes that is so important in terms of presenting to your clients and your patients. So that's not a small task. Right. In addition to just managing the day-to-day operation. I would just like to add too, here at MedCura Health, we have, in terms of developing new projects, we have started our first school-based clinic with Emory over at the United Doraville Elementary School, and we have 5 other school-based clinics on the horizon. So we're looking to expand there, and also as an FQHC, we want to be able to provide additional specialty services. So we have some projects on the table to expand our specialty services to the underserved community. So I love the projects that you guys are working on, and I think all of these things are helping us or pointing us towards serving the community better and improving healthcare outcomes all throughout the county. So this is excellent. Thank you. All right, let's see. What are your biggest challenges related to economic development for healthcare? I think I know what one of them would be, but what do you see as your biggest challenge related to economic development? Dr. V, I'm gonna start with you.
For us, it's we're really limited because we're limited by our funding sources, right? So we can only do so much just based on the available funding that we have. And then also public health funding oftentimes is very specific. So we will have very specific funding streams for very specific programs or services. And there isn't a lot of wiggle room outside of that. So that's a challenge. When we have more general funding streams and we're able to be a little bit more creative, we can hire staff that can do a variety of different things. But when you have certain programs, like I'll just say, for example, family planning, they can only do certain things in family planning. We can only hire a certain number of individuals for those programs. So that's our biggest challenge for economic development. I don't have a lot of room to grow programs or services when it's very tight.
That's one of the things that I've found also in terms of strategic planning. You're laying out your plans, but sometimes a lot of it depends on perhaps what funding streams will be available. So I certainly can identify with that challenge. It makes it tricky. So I definitely can understand where you're coming from. Let's see, Scarlett, what do you see?
Agree. Of course, medical costs are continuing to rise astronomically, and our ability to provide the best possible care for families and making sure that dollars are in place for them to be able to receive that care. We've got constant challenges with insurance companies, constant challenges with governmental guidelines, but just the flow of dollars from wherever they're supposed to come from. There always seems to be hiccups and issues that we're faced with on a daily basis, and it's ever changing. But we remain diligent. We keep our finger on the pulse of what's out there to know where funding sources are and to make sure that we're doing what we can to access those dollars.
Excellent. Jen?
Well, much like others have said, I think our our biggest challenges at the healthcare system right now really are pandemic related, specifically to the contract labor cost. When we as a system are off budget by about $80 million, and 83 million of that is in temporary agency staff. That is a very challenging. And so I think that, and a lot of that ends up being the folks that see that they can be incentivized by traveling and end up going to another system only to have us backfill. So it's almost like a rotation of where the staff are moving around to in Metro Atlanta. So contract labor cost, biggest thing right now, inflation, obviously, supply chain, just the ability to get the supplies we need to take care of our patients. And luckily, being part of a large system, we can leverage that with our contracts, but definitely is a challenge there. So really thinking, how do we change how we approach things? We're having to be very nimble, and that's a big thing. Surgery volumes for the system as a whole is just really challenging right now. So less elective surgeries, and really trying to get back to those volumes, because that's what really helps drive the hospitals. And so I think those are some of the biggest challenges right now, and just the workforce that we've talked about, throughout.
Looks like we're experiencing some technical difficulties here. I think I see a couple of screens that are frozen. I don't know if you guys see that or not, but hopefully you can still hear me okay. Can you all still hear me all right?
Yes.
Okay.
Yes.
And I can hear you too, but I think we've got some frozen screen challenges. All right, so we just talked about the biggest challenges for economic development, and Jen, you kind of touched on it, and that is the workforce.
Mm-hmm.
When you're in the your day-to-day operations, and you're looking at your workforce, sometimes it's easy to think that you're the only one who's experiencing recruiting staff, but I think it's something that we all have seen a sharp increase in challenge and how challenging it is over the last several months. So what are the challenges facing the healthcare workforce? Is it better or worse, do you think, in this industry than other industries? Scarlett, I'll start with you. What do you describe some of the workforce challenges you guys are facing there at CHOA?
It's primarily burnout. We need people. We need qualified clinical staff, and they are there and they're giving 100% and more, and it's still not quite enough. And I think the beauty of the work that we do in healthcare is that 99% of the people who are in this field want to be there. They want to provide a service and care for individuals who are in need, but they too need care from time to time, and they get burned out. We are constantly looking for nursing staff and clinical staff. And so I think it's just one word. The biggest challenge in the healthcare workforce is burnout. The needs are so incredibly great during this pandemic. There are not enough hours in the day to meet the needs, and not enough people. So we're trying our best to nurture and reassure our staff that we do care about them. We are concerned about them. We want them to remain healthy through all of this. And we're trying to find innovative ways of relieving some of the pressures they're feeling in terms of being able to fulfill their responsibilities and duties.
Jen?
Yeah, couldn't say it any better. It really just is the morale that we're trying to work through. So retention obviously is a big part of that. So what do we do to recognize our workforce for what they're doing? Can't always be in a monetary way. So we do look at how to be market competitive, but then we also are working on our health and wellness programs. What do we do to help support our workforce? We provide on-site counseling, and I think that that's been very helpful, because it's not only the workforce and what they're dealing with at work, but it's what they're dealing with at home and the personal stressors that they're running into that are causing that imbalance, if you will, between work and life. So really trying to work on those resiliency programs. It could be as simple as on Fridays, it's Comfy T-shirt Friday, giving out complimentary hot drinks, going around with a snack cart and just saying thank you. And I think, sharing the stories of exceptional care that we run into each and every day is something that helps to uplift us. Recently had one of our very incredible nurse leaders say, I just didn't know if I was making a difference. And she happened to get an email from a patient's family and telling her what an incredible job she was doing, how great the team was. And she said that one email, it's so simple, a free thing to send an email, take the time to do that, completely turned her day around. So sometimes it's just the very simple things that I think can help lift the spirits of our workforce.
Excellent. Dr. V, describe the challenges you're facing with the workforce.
Oh boy. COVID-19 has created many opportunities for the healthcare workforce. And for us, it's significantly impacted us because it's resulted in a loss of our workforce that have left for higher paying jobs, right? Why work here in public health when you could go get paid $100 an hour to do COVID-19 testing or vaccinations, right? And a lot of what we've done in the pandemic, in the response, we also would not have been able to do without contracted workforce. Sometimes our nurses left and became some of those contract nurses. That has been a very big challenge for us. It's very challenging for us to compete with the private sector. And, just as an example, numbers wise, we have about 500 total positions in the Board of Health. And in 2021, we had 151 resignations and 145 new hires. I mean, you can just imagine that cycle of turnover, which is very challenging. And especially for our clinical positions and our public health nursing positions, it's a challenge because it takes time to train a public health nurse, because public health nursing in Georgia is very different. They're by law allowed to do much more under a nurse protocol than they would in any other healthcare setting. But it takes a great deal of time to train a public health nurse to do all of those things. And so it's been quite a challenge. And, just similar to everybody, recruitment and retention are our biggest challenge right now.
So I've got a follow-up question for all three of you on that. Do you think that a lot of these challenges we have come about, well, some of them have come about because of the pandemic, I think. Do you think that once the quote-unquote pandemic is over, that these challenges will abate? Or do you think they are here permanently? I'll start with you, Dr. V, and then I'll go back around.
Oh, it's funny because my chief clinical officer and I keep talking about this, and her hope is, when everything calms down, everyone's going to come back. They're going to come back because these opportunities won't be available anymore. And I sure hope so, but I don't know. I'm trying to be cautious about it and not overly optimistic. I also think that, as you all, I'm sure, have seen too, because the pandemic has created many other opportunities for people to have more work-life balance and telework and really kind of reevaluate what they do, even if they were a dedicated healthcare worker, passionate about public health, healthcare, whatever. At the end of the day, if you had kids who weren't in school, right, it's a challenge to do your job and to be a parent and to do all that. And so many people have found other opportunities where they could use their clinical skills in a different setting. And I think leaving that and leaving some of those opportunities that have been created, I'm not sure that we're going to see that bounce back.
Jen, what do you think? Do you think we'll see a bounce back? I think that's a great way to put it, Dr. V.
Yeah. I guess I'm like Dr. V. I sure hope so. But I think, based on the workforce challenges that we're having, it's almost like a vicious cycle right now of supply and demand. And, for context, if prior to pandemic, we may have paid $40 to $60 an hour for a contract nurse, we're paying upwards of 200 to 230 an hour at this point. And so that really is, at what point does that stop? And I don't know, without having support from the community and even maybe legislative efforts to help us try to get that back in check. I think that is the biggest thing right now. And just allowing people the time to heal from what has been going on. I think we've all touched on the mental health aspect. And I think those individuals that have been in the healthcare trenches, really are tired. And so how do we help them be resilient and really get back to focusing on the care?
Scarlett?
Yes, I would agree. I think that the workforce now, you've had to learn how to be more creative in how you balance your work and your life. And going forward, I really feel like the workforce feels a little bit more empowered to speak on what they need to be productive, both at home and on the work and at the job. So I think it will be a bounce back. I do. But I think that as an institution, that we're going to have to be far more flexible in how we work with those individuals, with the staff that we need, because I think they know that if we don't help to accommodate a better work-life balance, someone else will.
Scarlett, that's a great point. And with my leadership team, this is something we've talked about quite a bit, that some of the old school tactics of managing people just don't work with this generation that's coming up now. Mm-hmm. And so we've emphasized that we actually have to change along with that. And it's hard. It's hard because there are some fundamental things I think that we learned that we have to do in order to have a successful business. And now that's changing. And so we have to be very careful about how we make those changes, but at the same time, be able to keep our workforce.
Yeah.
Good point. All right. The DeKalb Chamber of Commerce in DeKalb County, what can we do to assist? What can we do to help you grow? I'll start with you, Jen. What can DeKalb Chamber of Commerce do to assist you in helping you grow?
Yeah, I appreciate that. And I think the biggest thing that COVID has shown us is, our need to work together, and the community relationships really do help us to ensure that we're providing the best care to our patients. And so I think I always, one of my items I always say is it really comes down to relationships and communication, and how we make those connections. So if you have positive hospital experiences, we love to hear those, mention how that can really uplift folks, but we also need to know where we have opportunities to improve. So as members of the Chamber of Commerce, reaching out to me or others on our leadership team and letting us know where we might have some opportunities for improvement. I think that really helps us make sure that we are providing the best care that we can to the community that we serve.
Excellent. Dr. V, what can the DeKalb Chamber of Commerce do to help you grow?
I think for us in public health, probably the best thing to help us is to advocate for us and to advocate for public health, advocating to elected officials. And honestly, it's better when it comes from those who aren't in public health, right? And recognize the value and the importance of public health in the community, because, public health is a lot more than just serving the most vulnerable or the marginalized, right? We truly do more than that. And, if it weren't for public health, then who would be inspecting the 2,500 restaurants in DeKalb County, right? I think everyone in the community wants to make sure they're eating at places that have been inspected, that are safe, et cetera. And of course, wanting their family members and their guests and visitors to be staying at hotels that have been inspected, that are safe for them to stay in. For us to grow, it's important that there are investments in public health so that we can from an infrastructure standpoint and workforce standpoint, be able to grow. So really that advocacy would be important. And this might be a terrible analogy, but if you think about your car, you can either maintain your car and do all of the required maintenance and take care of it, and it'll, work great, or not do anything and eventually it's going to break down, right? So in public health, if we don't continue to invest in public health, then the breakdown for public health is going to be pretty steep cost to the community and to the overall outcomes and health of our community. And then the other piece I would say is also just recognition of what public health has done during the pandemic. I think that if you all have seen, certain things in the media or articles or things like that, often I think public health is put all the way at the bottom and not oftentimes recognized or under-recognized. So I always try to stress that and, stress that to our workforce, how much they are heroes, they're public health heroes, and everything that they have done, not only in our response for the pandemic, but continuing to keep our doors open to serve the community.
Excellent. Scarlett?
And so, ditto. Actually, Dr. V said everything I was thinking about saying. Be advocates for our services, recognize and acknowledge the work that we do. And then at the end of the day, we need evangelists who will promote what we do and talk about the hospital and the services and care that we provide. And then again, to collaborate and then invest in who we are and what we do.
All right, so I just wrote down some notes from that. Continue to work together, continue to develop relationships also with, particularly with organizations who can invest in healthcare in DeKalb County. The Chamber of Commerce can keep us connected so that we can share experiences and share opportunities. We can advocate for public health, and we can recognize public health. We can recognize what our hospitals are doing. We can recognize what our healthcare workers are doing, keeping them at the forefront. And I know that in times like these, our healthcare workforce probably feels a little underappreciated. And so we need to keep that at the forefront. And then ultimately, I think that these challenges always bring about opportunities. And so we want to make sure that we are well connected so that we can take advantage of those opportunities. All very good suggestions. Thank you. I'm going to go back to our workforce. I think that's one of the drivers helping us as we, I hope, Dr. V, emerge from the pandemic. We see those infection rates going down. I hope it's not a false indicator like perhaps it's been a couple of times I know I've gotten excited and then only to be disappointed again, but our workforce is so key for us to be able to continue to function. It's our most valuable asset. And so, Dr. V, I'll start with you. And I think we've kind of touched on this, but I want to just kind of go over it and have its own section because I think it's so important. And if you have to repeat some things that you said before, that's fine. But Dr. V, what are innovative ways to attract, and I'm going to say keep, healthcare workers?
Well, we can't do some of the fancy things that other people do to recruit and retain, but I think I just want everyone to know, and of course I'm biased because I'm in public health, but public health is a wonderful opportunity. I mean, I chose this path because I love this path and I love what I do and I love doing work that impacts everyone in the community. And it's truly a wonderful opportunity in a field for growth and development, from our clinical services, our public health staff get an opportunity not only to provide clinical services, but really to be involved in population health and learn about population science. And of course, in public health emergencies, they're in the front lines of, those responses. So it's just a wonderful training opportunity and development opportunity. And with us, with few exceptions, because I can't say that I did not work nights and weekends during the pandemic, because I definitely did. But, in normal times, whatever that is, with few exceptions, our public health workforce doesn't necessarily work on nights or weekends. We also are able to offer more flexible schedules. Oftentimes, actually, some of our staff are Emory employees, but work part-time for us because they're able to do that. So they have their, primary job at Emory, but because they're passionate about public health, they spend part of their week with us. So that's nice that we're able to do that and have, those hourly positions. So that gives our staff flexibility. And of course, we, during the pandemic, have been able to determine that some of our positions, are telework amenable and telework eligible. And so our staff can do good work that's serving the community, but can do it in a virtual format. And, we have paid state holidays, great retirement benefits, and a state pension. So I have to throw that out there for anyone who's interested in joining the public health workforce, because it really is a great opportunity.
Thank you. Scarlett?
So yes, greater flexibility in terms of what you expect of your staff. And technology has been a lifesaver, of course, for everyone through the pandemic. And I think that for those seasoned employees, I think that making sure that they are comfortable with the technology and be able to use it. So there has to be programs that help the employees understand how they can be far more successful in the work environment. I know there were so many challenges with some of the more seasoned employees who were not comfortable necessarily with some of the virtual programs, but now they are, because we were specific and very deliberate in making sure that they learned how to work from home comfortably. Also, one of the other things that we've looked at is making R&R mandatory. You have to have some time carved out. The employee doesn't feel guilty about taking that time if you've made it part of your policy and procedure. So I think that would attract a better workforce. Then be very constant and consistent in the recognition and rewards that you show. Was it Jen? I don't remember, Jen or Sandra, who talked about a family that thanked one of the workers. They want to know that they are appreciated and that the work that they do is valued. And whether it's a family or us, I think as the employer, I think we have to really be proactive in expressing appreciation and rewarding those employees for the work that they do. That serves to rejuvenate them and remind them of just how valuable they are to the overall, to the business. And there's something that we're going to be looking at, surprise and delight, that we think will help to keep employees invigorated and dedicated to the job. I worked at Delta for 13 years in my prior life, and that was something that we had. It was in the middle, just out of the blue, an employee may receive a special gift, lunch, an afternoon off. It was surprise and delight, and it was a way of saying thank you for your service. So that's something that we're looking at now. Perhaps others can try that.
Great ideas. Jen.
So Scarlett, I may steal that one. That's a good one.
And it's easy.
It is. Yeah, I really think it does go back to the recognition of our staff in any way that we possibly can. And I think we're also looking at what are some ideas, especially for the leaders. There's the frontline folks, but there's also the leaders who, as we've gone through this, we need to make sure that we're valuing their time. So we've actually implemented or trying to say, emails are for during work time hours. You don't need to be continuing to look at your phone after 5 o'clock. If there is something that needs more immediate attention, then texting someone to look at it, but allowing folks to disconnect. And I think to your point, that mandatory, I need you to take a day off.
Yeah.
I'm recognizing you're a little stressed and go off the grid is kind of what we laugh about. So I think that really is the biggest thing right now that we can do is make sure we're market competitive, but also there's the non-monetary recognition aspect. So that's a big part. And then I think as we're trying to position ourselves for the workforce, is working with our local high schools, trying to engage our students to pursue healthcare careers. And it doesn't always have to be a clinical career. It could be some of the support services, our housekeeping, our cafeteria, those items. So really trying to engage with those local high schools and giving some training opportunities. Volunteering programs in the summer really helps with that, and just getting folks back in and helping us as we work through. And a lot of that means touching base with our staff and understanding, from them. I think a lot of times we may think we know the answers, but sometimes the answers are a little closer to the front line. And sometimes just that listening ear can really do wonders. So.
Very good. These are all great suggestions, and I sometimes feel like in healthcare we have to be better at it than everybody else. And the reason I say that is because they're better at recognizing staff and providing training opportunities and things like that. Because healthcare is a high touch industry. You can't exclusively do it over the internet or over a computer. And so we still need our workforce to be in the office or at the clinic each and every day. And there are a lot of opportunities where people don't have to do that. They can just sit at home or work remotely and get their jobs done. And so we have a bigger challenge in providing opportunities that people are satisfied with and want to be a part of. But I think all these, I wrote down some notes here, all these are really good suggestions. Letting people know that in healthcare, there's an opportunity to really impact people's day-to-day lives. I think that's really big. Training opportunities, telework and technology. Technology, again, because healthcare is such a high-touch thing, it's a little bit harder sometimes to implement the technology, but we still have to find new and more and creative ways to use technology. I like the surprise and delight also. Scarlett, you really helped us all out on that one, because I think the workforce that we have now, they want to be recognized. And then Jen, you also mentioned that they want to be heard. It's, we think we're listening, but as listening as defined by our growing workforce is not the same as what we thought listening was. And so we really have to have an open ear, allow people to sometimes vent, allow people to say what's on their mind, and then turn that into a positive so that we can continue moving forward. And then there's some ideas on disconnecting. My brother-in-law works at an organization where you can only work 8 hours and then you have to go home. Wow. That's hard in healthcare to because people's needs day to day go beyond 8 hours sometimes. And so it's important that we give our staff the opportunity to disconnect and let them know that, so that they feel as though they're not being run down, because sometimes that's just the nature of healthcare. And then I think I touched on this also, and I think you all touched on it too, and that is providing training opportunities, not only for our current staff, but for reaching out to our high schools, reaching out to some of our training facilities, and just giving them training opportunities to come and see. Sometimes we may feel like in healthcare, providing those training opportunities for those who are currently in school kind of slows us down, but we actually need those individuals to come in now so they can see what we're doing and show them how rewarding being in healthcare is. So I think all of these suggestions are really good and very, very helpful. We have a few more minutes here. Any closing comments from Jen, Dr. V, Scarlett? Any closing comments as we close out here over the next few minutes?
For the forum and giving us all an opportunity to kind of share our experiences. I think it is so important that we realize we're not alone. We're all experiencing the same challenges, and what we can learn from one another by sharing that is so helpful.
Thank you. Thank you.
Ditto.
I agree.
All right. Well, thank you, Jen, Dr. V, Scarlett. Thank you so much for your time this morning and being a part of this discussion. It's been very helpful. I see just a few comments in the chat section, just thanking you for your input. This has been very eye-opening. And I think we're all looking forward to emerging from this pandemic where we can, well, I won't say get back to normal. I don't think we'll ever be back to normal, but we can look forward to getting back perhaps to the core of what we do and not have to deal with these other challenges that the pandemic has brought about. At this time, let's see, we've got about 7 minutes. We're just a little bit early. But what we'll do is we can transition back to, there should be a button on your screen that says stage. When we officially close out here, you can just click on that, and I think a screen will pop up, and then the featured speaker will come on at 9:30. So again, thank you, panelists. Thank you for those who attended, and we look forward to continuing to partner and working together to improve the overall healthcare and health outcomes of DeKalb County. Thank you very much.
Thank you.
Thank you.